Okay, we'll go ahead and get started. My name is Sheila Swarren. I'm one of the transplant hepatologists at Rush Medical Center. And we talked about liver transplant in general earlier this month, and then Dr. Alaman discussed living donor and how it relates to liver transplant. And then I was asked to now speak about support information for liver transplant. So it's important because a liver transplant is a very big process. It requires an entire evaluation, and it's a very big surgery, and there's a big dedication from the patients, from the family, from the transplant center, physicians, nurses, support staff. It's a big commitment from the community and society at large because it's a big process to help with this life-saving surgery for patients in need. So first, just to review, what is a liver transplant? A liver transplant is a surgical procedure to remove a diseased liver. On the left, you can see there a cirrhotic liver, and replace it with a healthy liver from a donor. And as we've discussed, it could be a deceased donor or someone that's died and given their organ to the recipient, or a partial living donor. Most liver transplants use a deceased donor, but some come from a living donor. So who needs a liver transplant? Well, people with liver failure from an acute illness, such as Tylenol overdose, or sometimes shock to the liver from a low blood pressure, or other causes of acute liver failure, those patients or people may need to be evaluated for a liver transplant, or chronic causes of liver disease. And chronic liver failure may manifest as ascites with the fluid in the abdomen, lower extremity edema or leg swelling, encephalopathy, which is confusion related to high ammonia levels, or bleeding from esophageal varices. Also, liver cancer is an indication for a liver transplant. And on the left, you can see that's ascites, water in the abdomen, liver cancer in the center, and then the liver transplant surgery itself. There are several different causes of liver failure: viral hepatitis B and C, fatty liver, autoimmune diseases, other genetic causes, and alcohol. Alcohol is the most common cause of chronic liver disease in the United States, and a lot of times people can improve just with alcohol abstinence. But these are all different types of liver failure leading to the need for a liver transplant evaluation. So the liver transplant is a process. It's not just the surgery. It starts with the diagnosis of liver disease. Then you have to evaluate and treat the specific liver disease. The process includes testing to determine if someone is a transplant candidate, and listing for a liver transplant as part of the process, and then waiting for the liver transplant itself. And then once the surgery is performed, there's a ton of after-transplant care. It's not just a surgery and then the patient goes home and never has to follow up. There's a whole process and need for after-transplant care. So because this is a long process with multiple steps, there's a lot of support needs, which brings us to the topic of this discussion. There's emotional support needs. You know, it's a big process. There's a lot of ups and downs. There's a lot of emotions, good times and bad times, and patients going through this process need emotional support. There's also support that's needed to sort of navigate the system logistically, coming to the hospital for office visits, picking up prescriptions, being able to call the transplant center, your doctors, if you need anything, if you have any questions, all of that, even for someone that's healthy, is a challenge. So support is needed to navigate the system through this process. As liver disease progresses, people have a more difficult time physically taking care of themselves, keeping appointments, and maintaining their health. And so there's physical support needs. Sometimes people can't even walk or, sleep well, and so there's physical support needs through the transplant process. Because there are office visits, hospitalization, blood work, medications that need to be picked up, there's transportation support needs for people going through the transplant process. And because it's a big surgery, there's a financial piece to transplant. Insurance generally covers the transplant process, but a lot of different insurance require the patient and families to contribute a portion of the financial burden. And so sometimes this becomes an issue through the transplant process. Also, remembering to take medications and staying motivated to take medications may require additional medication compliance support. And because some of the most common causes of liver disease are a result of substance abuse, alcohol or drug use, a lot of times people that have stopped using drugs or drinking require ongoing substance abuse counseling, and so that's a support need throughout this process. So different ways to find support. It first starts with family, family first. It's really important that you reach out to family, and if you don't have any family, reach out to friends. Friends can be family. They can come to appointment. They can come to the hospital. You should encourage families to come to meet the providers and encourage them, family and friends, to come to support groups. The more open you are and open patients are with family members and friends, the more support you can get to get through the process successfully. Keep in mind that the patient going through the transplant process is not a burden to the family. In fact, the way family and friends should look at this process is that the patient needs help now, needs support now, so that they will be there to help families and friends and give back to the community and into the future. So, and patients oftentimes feel some guilt related to asking for support from family and friends, but if you keep in mind that your family will help you now so that you can be there to help them in their time of needs in the future, then you can have less guilt feeling about that. And then you can reach out to community resources like Alcoholics Anonymous. A lot of people feel that there's some stigma related to Alcoholics Anonymous, and there are alternatives to AA that are not. Some people feel that there's some religious or Christian themes associated with AA, which is perfectly fine, but some people are turned off by that. And there are a lot of alternatives to AA that are out there. And then religious groups can also provide solace and support through the transplant process. And then reaching out to the local Department of Health or national support. There are websites and resources out there through the VA, through the Centers for Disease Control and Prevention, through the NIH, that all give you resources about education, about about support groups, and about research that's being done on different liver diseases. A very helpful website is clinicaltrials.gov. So You can go on that website and you can put in your diagnosis, and there is a registry of all the research that's going on. And sometimes it's very helpful for the more rare liver diseases or less common liver diseases to know sort of what your options are. If there doesn't seem to be that many at a provider you're looking that you're working with, then you can look on the clinicaltrials.gov and you can see what else is out there. So you don't feel so alone. There's local groups, there's national groups, and there's research groups. There are a lot of groups out there that can help you. And then obviously, as you're meeting with your medical professionals, your physicians, your liver transplant team, all of these people are here to help you be successful in your process for liver transplant. So the social workers working with the transplant team can identify your needs in terms of any transportation or support or substance abuse needs. That's what social workers are there for, to identify what needs you have. The financial coordinators or counselors can help you identify any financial gaps as you're going through the process. They review your insurance plans and make sure that your insurance will cover transplant at various institutions. The pharmacist, when you meet with the transplant team, will go through your medications, make sure that there's no medication interactions. They will make sure that you are able to get your medications and you understand how to take them. The dietitians make sure that from a dietary and nutritional standpoint that you are in the best possible position to be successful with your liver transplant. Sometimes people with liver disease are underweight, they're too thin, and then they don't have enough muscle mass or strength or energy to undergo the transplant, and so we sometimes want people to gain weight. And then more often than not, patients are overweight, and we require people to be within a certain weight to be candidates for a liver transplant, and so the dietitian will identify these issues and give counseling around that factor. Transplant coordinators, they do just what it says. They coordinate. They coordinate the transplant. They coordinate all the testing that needs to be done. They're there for you as a friend. They're there as your cheerleader. They're there to help coordinate all your testing and make sure that you understand and are engaged in the process. Psychiatrist is there to help with any substance abuse and depression issues as you go through the process. It's very common to have psychiatric illnesses as related to the liver or unrelated, and we all know that the mind and the body are connected, and psychiatrists can help people work through issues to allow for a successful liver transplant process. The medical physician is a hepatologist, that's what I am, and we do the medicine side of liver transplant. And so we should be supporting you through the pre-transplant and remote after-transplant care to allow you to understand your new liver and what it means to take care of it. The surgical physician performs the surgery and is there to support the liver from a surgical standpoint through the process. There are governing bodies that determine and regulate liver transplant in the United States. The HRSA, or Health Resources and Services Administration, is a division of the U.S. Department of Health and Human Services. And the SRTR and OPTN, that's Organ Procurement Transplant Network, are the two big bodies that fall under the HRSA. And basically they govern research, policy evaluation, and organ allocation and policy development respectively. And we as a transplant institution and you as patients will be monitored by these governing bodies to make sure that processes and procedures are up to standards. So it's nice to know that there's support in a broader global extent to make sure that policies and procedures are being followed to give people and patients the best possible outcome. And the American Liver Foundation, of course, is an excellent resource for support for patients undergoing the liver transplant process. They put out webinars just like the one you're listening to and watching right now. And so even by just reaching out to the American Liver Foundation, there's a website cited there. They have webinars, education, national helpline. You could just pick up the phone and ask any questions related to the liver, and they will find an answer. The American Liver Foundation is on Facebook, Twitter, and there's just a ton of information on the website, and the hosts of this webinar are amazing, and they just are a wonderful source of support for people going through the liver transplant process. And then also on the American Liver Foundation .org website, there are different foundations for specific liver diseases. So some of the less common liver diseases and some of the more common liver diseases have advocacy, education, and a place where you can meet people that have gone through similar experiences, and so all of that's on the website. And the internet is an amazing source of information. You do have to be a little bit careful and make sure that you go to more recognized sites, and I think the American Liver Foundation to be used as a tool to identify sites that are reputable and that have been vetted, I think is a real asset, because there's a lot of misinformation out there, and you want to make sure that you're getting the correct and appropriate information. And then the best thing to do if you're looking for support is to get involved and give back. The more people talk about liver-related issues, liver transplant, organ donation, and talk about your experience, you can see how you giving back helps others, and therefore get some support also within the community. So the Gift of Hope, organ donation, American Liver Foundation, as I mentioned, and ask around. The best way to get back is to give back. And the Liver Life Walk in Chicago through the American Liver Foundation is June 4th. And so I'll be there and hope to see you all there, because this is the topic of this webinar is support for liver transplant, and I think the community is the best place to find that support. And so it opened my eyes giving and preparing this lecture, so I hope it's given you some information too, and I'm happy that it will be posted in the future for people to refer to, because there's a ton of information, there's a ton of support out there, and I'm happy to answer any questions.
So at this time, if anyone has any questions, could you please type it into the message box? There's always the option to send myself an email and I can find out the answer for you. But if there's no questions at this time, we'll conclude this webinar. Thank you so much for attending.